Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on atrial fibrillation. You now have 90 seconds to read questions. Hello, my name's Dr. Sarah Miller. I'm a cardiologist, and today I'm going to talk about a common heart condition called atrial fibrillation, often abbreviated to AFib. Let me explain a bit about this condition. AFib is a type of irregular heartbeat, or arrhythmia, which can lead to blood clots, stroke, heart failure, and other heart-related complications. Many people with AFib might not even realize they have it because the symptoms can be mild or easily mistaken for other conditions. However, untreated AFib significantly increases the risk of stroke. In fact, it's responsible for around 15 to 20% of all strokes. AFib occurs when the electrical signals in the heart's upper chambers, known as the atria, become chaotic. This causes the heart to quiver or fibrillate instead of beating normally. This irregular rhythm disrupts the blood flow, which can cause clots to form. If a clot travels to the brain, it can block blood flow, leading to a stroke. One of the key symptoms of AFib is palpitations, or an irregular heartbeat. Patients often describe it as a fluttering sensation in their chest. Other symptoms include fatigue, shortness of breath, and dizziness. However, as I mentioned earlier, some individuals may not experience any noticeable symptoms, making regular checkups vital, especially for those at higher risk. AFib is more common in older adults, and the risk increases with age. It's also more prevalent in people with underlying conditions such as hypertension, diabetes, or heart disease. Lifestyle factors can contribute as well, with obesity, excessive alcohol intake, and sleep apnea being notable risk factors. Interestingly, studies have shown that stress and even caffeine might exacerbate AFib symptoms in some patients, though the evidence is mixed. Let me share a case I encountered recently. A 68-year-old man named John came to see me after experiencing episodes of what he described as a racing heart and breathlessness. These episodes were sporadic, and he hadn't thought much of them initially, attributing them to stress at work. However, during a routine checkup, his primary care physician noticed an irregular heartbeat and referred him to me. After conducting an ECG and monitoring his heart over 24 hours, I diagnosed him with paroxysmal AFib, where the irregular heartbeat starts and stops on its own. John's case is a good example of why AFib can sometimes be tricky to diagnose. Because his episodes were intermittent, it wasn't immediately clear that AFib was the cause. However, once we had the diagnosis, we could start discussing treatment options. For John, lifestyle changes were the first step. He was advised to reduce his alcohol intake and lose weight. We also started him on a blood thinner to reduce his risk of stroke, which is crucial for AFib patients. When treating AFib, it's important to consider the broader impact on the patient's life. Many people with AFib live in fear of having a stroke, which can cause significant anxiety. Some patients may even limit their physical activity, worrying that it could trigger an AFib episode. That's why it's essential for healthcare providers to offer not just medical treatment, but also support and reassurance. Counseling can be very helpful for patients who struggle with anxiety related to their condition. In addition to lifestyle changes and medication, some patients might require more invasive treatments. For instance, if medications don't adequately control the AFib, we might consider cardioversion, a procedure that uses electrical shocks to reset the heart's rhythm. In more persistent or severe cases, ablation therapy, which targets the heart tissue causing the irregular signals, can be an option. Each treatment plan needs to be tailored to the individual, considering their overall health, the severity of their AFib, and their personal preferences. Let me also mention the importance of monitoring AFib over time. Even if a patient's symptoms are under control, AFib can still pose a risk. Regular follow-ups are crucial to ensure that the treatment is effective and that the patient's risk factors are managed. For instance, keeping blood pressure in check is critical, as hypertension can worsen AFib. Patients also need to be vigilant about any changes in their symptoms and report them to their healthcare provider promptly. Another case that comes to mind is a 52-year-old woman named Lisa, who was referred to me after experiencing unexplained fatigue and dizziness for several months. She had no significant medical history, but she was under a lot of stress due to her demanding job. Her initial tests didn't reveal anything conclusive, but an extended heart monitor showed that she was having episodes of AFib that coincided with her stress levels peaking. This case highlights the need for thorough evaluation, especially when symptoms are vague or attributed to other causes like stress. Lisa's treatment focused on stress management, which included counseling and incorporating regular exercise into her routine. We also discussed dietary changes, such as reducing her caffeine intake, as there was a suspicion it might be contributing to her symptoms. Although caffeine's role in AFib is still debated, in Lisa's case, reducing her intake appeared to help. In summary, AFib is a common, but potentially serious condition that requires careful management. Early diagnosis, appropriate treatment, and ongoing monitoring are key to preventing complications such as stroke. Patients need to be proactive in managing their health and should work closely with their healthcare providers to tailor a treatment plan that addresses not just the physical aspects of AFib, but also the emotional and lifestyle impacts. Extract 2. Questions 37 to 42. You hear a doctor giving a detailed presentation on rapidly evolving landscape of healthcare. Now, read the questions. You now have 90 seconds to read questions.
Hi, I'm Dr. Emily Carter, and today, I'd like to explore the rapidly evolving landscape of healthcare, particularly how technology is reshaping patient care and diagnostics. With the rise of digital health tools, telemedicine, and AI-driven diagnostics, we're witnessing a profound shift in how healthcare is delivered. The future of healthcare is not just about curing diseases but preventing them and ensuring a better quality of life through continuous monitoring and personalized care. One of the most significant changes we've seen is the integration of telemedicine into everyday healthcare. Before the pandemic, telemedicine was a convenience. But now, it's a necessity. Patients can consult with their doctors from the comfort of their homes, reducing the need for in-person visits, especially for routine checkups. This shift has made healthcare more accessible, particularly for those living in remote areas or with mobility issues. The convenience factor cannot be overstated. Imagine a patient in a rural area, hours away from the nearest hospital, who can now get expert medical advice via a video call. However, there are concerns about the impersonal nature of telemedicine. Some argue that it lacks the human touch, the personal connection that is crucial in a doctor-patient relationship. I believe that while telemedicine does change the dynamics of patient interaction, it doesn't necessarily diminish the quality of care. In fact, it allows doctors to follow up more frequently and provide care that is more in line with the patient's lifestyle. The key is finding a balance between technology and human interaction, ensuring that patients still feel heard and cared for. Let's delve into diagnostics, another area where technology is making waves. Traditionally, diagnosing conditions has been a time-consuming process, involving numerous tests and specialist consultations. But now, with advancements in artificial intelligence, we can diagnose certain conditions much faster and with greater accuracy. Take radiology as an example. AI algorithms can now analyze imaging scans and detect anomalies that might be missed by the human eye, especially in the early stages of disease. This doesn't mean radiologists are becoming obsolete, far from it. Instead, they are evolving to interpret AI findings, making the final diagnosis more precise and informed by the best of both human and artificial intelligence. Cardiology is another specialty that's being transformed by technology. Wearable devices, like smartwatches and fitness trackers, have moved beyond counting steps. They now monitor heart rate, detect irregular heartbeats, and can even predict the likelihood of a cardiac event. These devices continuously collect data, which is then analyzed by sophisticated algorithms to provide insights into a patient's heart health. This real-time monitoring allows for earlier intervention and personalized treatment plans. Cardiologists now have access to a wealth of data that wasn't available before, enabling them to make more informed decisions and tailor treatments to individual patients. Now, let's talk about mental health, a field where digital tools are making significant strides. Mental health apps are becoming increasingly popular, offering everything from meditation guides to cognitive behavioral therapy exercises. These apps provide support to those who might not have immediate access to a therapist, helping them manage their mental health on their terms. But while these tools are beneficial, they should not replace professional care. The human element is critical in mental health treatment. Digital tools should be seen as supplements to, not substitutes for, traditional therapy. Finally, let's consider the role of genomics in personalized medicine. With the cost of genome sequencing dropping dramatically, it's becoming more feasible for patients to have their genetic information analyzed. This data can help doctors predict how a patient might respond to certain medications or what diseases they may be predisposed to. In oncology, for instance, this information can be used to design highly personalized treatment plans that target specific genetic mutations within a tumor. This approach not only improves the effectiveness of treatment but also reduces the risk of adverse reactions. So, where does all this leave us? My conclusion is that while technology is indeed changing the face of healthcare, it's doing so in a way that complements and enhances the human touch rather than replaces it. We are moving towards a future where healthcare is more proactive, personalized, and accessible. However, we must ensure that in our pursuit of technological advancement, we do not lose sight of the importance of human connection in medicine. The challenge for healthcare professionals will be to integrate these new tools while maintaining the empathy and compassion that are the cornerstones of good medical practice.